Good morning. My name is Jenni, and I am the Senior Oncology Specialist with Agena Bioscience for the US and Canada. For those of you that don't know who we are, at Agena, we manufacture a PCR-based mass spectrometer called the MassARRAY. And the MassARRAY is designed for a myriad of platform and utilization, but this morning I'm going to focus on our oncology portfolio and how we believe that MassARRAY is ideally suited to complement comprehensive genomic profiling using NGS. All of us know that NGS is a critical part of understanding cancer genetics for both solid tumor and liquid analysis, but we also know that there are limitations. And a lot of those limitations are, turnaround time. And even at the best, we're looking at minimum of 7 days, but usually on average 2 weeks to 2.5 weeks from time of accessioning to delivering results. For a lot of patients, this is too long. Particularly an example would be those patients that are diagnosed with advanced stage non-small cell lung cancer, where we know that certain genetic identifications of alterations are critical before a patient can even be put onto a systemic or targeted therapy. As a medical director once shared with me, tissue is the issue, right? And with FFPE samples, we know that we oftentimes have limited quantity. And even when we do actually have tissue that we can utilize for analysis on an NGS platform, around 20% of those samples actually QNS either due to degradation or insufficient tumor cellularity. Also, if you are an independent lab or a health system or a commercial laboratory, it's obviously vitally important that you have a program and bioinformatics infrastructure for the analysis and curation of the data that you're going to be then delivering results for, whether it's research or treating physicians. So where we believe that the MassARRAY fits in and fills in some of these gaps, whether you use it prior to NGS or you use it concurrently, is that we only require a small amount of tissue. For the panels that we have off the shelf, as well as our customizable options, it's about 10 to 20 nanograms of tissue. We're also able to deliver actionable and highly sensitive results with as little as 2% tumor cellularity, where most tests ideally want 40, but can usually deliver results with anywhere between 10 and 20. So for those samples that may be degraded or we're concerned because they're older, whether or not we're actually going to be able to analyze them, on the MassARRAY system, it's likely that you would be able to do so for specific tumor types. Our turnaround time is stellar. So again, for those patients, particularly the example I spoke about a minute ago with non-small cell lung cancer, when actionable results are critical as soon as possible, results can be delivered anywhere between 24 and at a max 72 hours post-accessioning of the sample. And our design is specific to look at what we know to be the most common areas of the coding and non-coding regions of the genes that are going to deliver those results where alterations exist that can be targeted, or at least we understand that there may be resistance mutations. And that's for lung, colon, melanoma, and hematological malignancies. Again, we are highly sensitive because we're specifically and targetedly designed. So our solid tumor panels can actually identify variant allele frequencies as low as 1%, and our liquid assay as low as 0.1% VAF. We're also capable of doing serial monitoring and resistance mutations. These are our off-the-shelf offerings, and I want to thank you guys for your time. If you have any questions, please visit us at booth 6. Take a look at our website, and we are always looking for opportunities to partner and collaborate, so feel free to reach out to me to discuss what your research or clinical needs may be. Thank you.